I was diagnosed with breast cancer in October of 2012 and was totally shocked because I don't have anybody in my family who has ever suffered from it.
For Johna, she has breast cancer or breast carcinoma, and unfortunately she presented at what's still a curable but an advanced stage.
We were thinking at that point that I would just have the surgery, the mastectomy, and that would be all I needed. But once I went into the surgery, they discovered that it had traveled into 4 lymph nodes.
Since it was an aggressive tumor, the size of it, and also it involved some of the lymph nodes in her axilla or armpit, she then received chemotherapy. We administer that here in the office as an outpatient. So she received several months of chemotherapy, personalized to her case, and then she'll go on to receive radiation therapy after that.
I didn't even have to think twice about whether I wanted to stay with him. Everyone said you have to really, really like your oncologist because you spend a long time, lots of years with them. And we walked out of our first appointment and I said, I really, really liked him and I don't feel like we need to look any further.
Johna's doing fantastic now. She really just impressed me with how she did with the chemotherapy. She did probably as well with the chemotherapy as any patient I've treated.
From the diagnosis until right now, it's been 16 months, the journey. I did chemo for 6 months. I had to do 16 rounds and then 33 rounds of radiation, and then went through the reconstructive surgery just a few weeks ago. But everything's looking clear, and I'm starting to feel really good again. Today, at the end of all this, I have a real different perspective on life. I always have been a positive person, but now I feel like I'm even more so. And the little things just aren't important, because when you go through something like that, the big picture becomes very important, and I just feel stronger and able to go forward now. And it's a wonderful thing.